Okay, yep. So we're going to do the anterior leg massage today. First of all, we're going to start with spreading our lotions, just some plain Petrissage. Again, from teaching perspective, we're looking at posture, where we're going to step into the movement and then draw back. As we get up to the top, if you just look down, you need to be in line with your foot, your knee, your hip and your elbow. So what we don't want to see is you leaning out in this position or bending your elbows like this. So slide in, up and over, and glide back. In, up and over, and glide back. When you spread your lotion, come up to the top of the thigh, and we're just going to continue to warm the thigh, just with, again, some general Petrissage, and with some Petrissage movements. So when we're working at our Petrissage movements, what we need to remember, again from a posture point of view, is a seated position, so tuck bottom in, stomach under, and you've got this sort of seated squat position. And when we're working the tissues, you need to remember that Petrissage is a lifting motion, and you need to lift tissues as underlying structures. So if the movement isn't lifting, then it isn't Petrissage. As we lift up, you're cupping the skin, the muscle between your fingers and thumb, but you're not pinching. You're feeding the tissues from one hand to the other. As you work around the thigh, you need to drop your posture and move through your legs. Ringing is another type of Petrissage movement we can use. And again, we're in our seated squat, our supported postural position, and we're lifting up to the ceiling, dropping, and then lifting again. Your feet need to be facing the direction you're working, so in this case I'm facing the couch. We can, if we want to, incorporate some hacking and cupping, some Supine movements. Again, watching our body position, so we've got a nice strong posture, relaxed shoulders, and we're moving through our lower body, not through our upper torso. If we're working more sports related massage, then we can start to work through the tissues now. So now we've started to warm the area up, we can start looking at different hand positions. I'm going to lower the couch because what I want to do is use my body weight a little bit more effectively. So there's several positions that we can use, hand positions. We can use hand on hand, where it's a reinforced Petrissage and we're going slightly deeper. Again, we're rocking and rolling from the back foot through to the front foot, and what we're trying to do here is assess the tissues. So we're working on our palpation skills and feeling for any areas that may need further treatment. Notice I've slowed right down so I can feel what's going on, and I'm working more on top of my hands. So my weight hand is my hand that's on top. This bottom hand is just giving me the surface area. So there's no tension going through this wrist or this elbow. The weight is coming from the hand that's on top. Shoulders are relaxed. And you're just moving from back leg to front leg. If I find areas of tension that I need to work more on, then I'm going to start working both longitudinally and transversely. So I might use deeper methods of tissue. So healer hand on my fingers, that gives me a smaller surface area. If working on a smaller surface area, I'm going to be going deeper. You may want to lower the couch slightly so that your shoulders are relaxed and you're getting your body weight more effectively over the area you're working with. With going deeper, we need to remember to go slower. Maybe looking at working in smaller areas for this. So we found an area of tension somewhere that may need a little bit more work. And we're going to slow right down so we can work the tissues. We can go in a variety of directions. But in whatever direction we're going, the bottom hand is always relaxed and the weight is always coming from the top hand. If I want to go deeper still, then I can use a smaller surface area. So in this case I'm going to use my thumb. I'm going to place my hands nice and relaxed on the area, and then my weight now is going to go over my thumb. So you'd use this for areas of tightness specifically that you want to work into. This is very deep, so you do need to be very slow. You need to consider the tissues, allow them to adapt to your depth and your pressure. You need to consider the feedback of your patient, both verbally and from a body language point of view, and then gently stretch the tissues. So just to show you how much I've moved there, I've gone from this position here, I've rocked through my back leg to my front leg, and I've stretched the tissues, possibly about half a centimetre. So weight on there. My patient adapts to the surface area, and I can stretch the tissues. I can do that in any position on any area of the muscle that I want to, but however, when you've gone deeply, then it might be a good idea just to give a little bit of effleurage or petrissage just to ease off the tension in the area you're in. If you want to work more of a side, it might be useful to use your elbow into your hip and use your hip for the weight instead of using hand on hand. I'm going to work on the iliotibial band. I'm going to raise the couch a little bit so I can do some longitudinal work on the iliotibial band. The iliotibial band is quite ligamentous in properties, so how much movement you're going to get is debatable. However, you could always work on the tensor fasciae lata just at the top there if you wanted more range. So this time what I'm going to do is I'm going to use my body weight leaning into the area and tuck my elbow into my hip. Support my wrist, and then I'm going to use my knuckles, to flatten my knuckles, just to stretch these tissues. So again, it's quite a deep movement. So I'm going to lean in, check my patient's okay, and then my weight moves from my back leg, pushing through to my front leg. And I can do that going 2 steps up, 1 step back, until I've covered the area, so I can work the whole of the area along there. So that's longitudinally. I can also treat the ITB by working from the opposite side of the couch and going from posterior to anterior. So again, we feel that the tissue changes there. I'm going to put fingers on fingers this time, and I can work from the top down to the bottom. Slide until I feel that I've hooked onto the iliotibial band, one leg behind the other, straight arms, drop my body weight, and gently stretch the tissues. Again, you're only looking at moving possibly a centimetre and a half. And again, you can work in sections, working down through to the knee. If we want to now work on the adductors and the adductors there, we can need to move the leg out. Again, several ways in which we can do this. I'm going to support the knee. I'm just taking the knee from this position here and using a towel. So I've got a bolster underneath here and a towel. So if I wanted to, I can use this position. I'm going to lower the couch, and that'll give me nice access to the adductor area. Again, it can be very tender, very sensitive, and very painful to treat, so you need to be aware of your patient's responses. Just do some general warming. First of all, this is relatively light. I can do some petrissage, some effleurage on the area, and then when I'm happy that it's nice and warm, I can work in with a little bit more force. So I can do hand on hand, again, just pressing in, moving from back foot to front foot, slow down because I want to feel what's going on. If I can feel there's a little area of tension, then I might want to concentrate my efforts on there. Got a little area here that's just a little tight, so I'm going to go in with a little bit more tension. Again, lower the couch. So I can use my body weight more effectively. What I don't want to do is have my shoulders around my ears. So I've made my surface area smaller. My hand goes over my fingers. I allow the tissues to change underneath my fingers. And then gently push from my back leg to my front leg. Okay, then. Again, you can work in sections. And working in different directions. So again, change your hands if you need to change your hands. The weight is still going to come from the top hand. The bottom hand is still relaxed. If you don't relax your bottom hand, if you end up working in this position here, you'll get carpal problems. So this hand must be relaxed. The weight must be from your top. You can, if you want to, do this without bolsters and using your knee or in a seated position, so I'll just show you those. So if I wanted to, I can put my knee in that place instead of the bolster and we'll do exactly the same thing with my knee, or I can sit and place the knee across my leg and again work. You must be careful in these positions though about your posture. You still need to make sure you have a straight back and the movement comes from the back leg through the body rather than just upper body being involved. So you must push from the back leg through the front leg. And it may be more difficult to get more pressure through there. We can work the knee in this position again. You might want to do it standing or seated. It's very often useful to seat yourself on the couch because then you can just make sure that the feet stay put and the leg is more stable. And again, we can do some general effleurage. And then we can do some finger and finger work, just stretching tissues away. Again, just rocking from the back leg through to the front leg. Along there, so we can work around there, just trying to tease the tissues away. We can do some finger on finger work. Again, just down the side of the knee where we're working some of the adductor tissues and working into the pes anserinus, and also some on some of the lower fibres of the tensor fasciolata. And again, from a posture point of view, you're just rocking and lowering your back knee slightly, just to allow that movement. What you're not doing is that. You're not working in that position then. The lower limb. Difficult, there's not very much muscle tissue on the lower limb.